Um, Hello. I would like to start by introducing myself. I'm Sanya Chitkara, and I'm based in Delhi NCR, and I have completed my graduation in MBBS from Uzbekistan, and I graduated this February, and I took the FMGE exam this June and passed. All right. So I would like to start by saying that I also have an Instagram account, okay, and I also post a lot of FMG related stuff in here. So if you would like to check it out, maybe it could help. So yeah, give that a check out. Okay. So firstly, this is the main thing I would like to say because everybody should keep in mind that this is just my own journey. And I am not endorsing that anyone or everyone should follow this at all because everyone has their own journey of what they have done in the past and how the things worked out for them. Okay, so I'm just here to share my own journey, and I'm not claiming at all that this is you should follow. Okay, now why you should watch further is because this session could help you fill the gaps in your preparation strategy because this is coming from a student's perspective. So what we have heard so far is we've heard teachers perspective that because they've mentored so many students, they know what works. But being in that position, I was there a few months ago, and being in that position, I would say that maybe it could help if you listen further, and it would help you to get an idea of maybe filling some gaps that you would have in the strategy that you're following right now. Okay, so now we'll actually start. So starting by how did I start my preparation? I was not studying from the first year because I've heard a lot of people saying that you could only score better marks if you're studying since the first year. That was not my case at all. I started in the fourth year and I only started studying the subjects that were being taught in the university itself. Like they were, my ENT teacher was very strict. So they said that we have to read, like maybe, for example, deviate in nasal septum the next day and then ask questions, or otherwise they put rework or whatever happens. And so we had to start that way. So instead of reading just books, I started watching lectures. I already had a PrepLadder subscription. So I started watching some lectures and I started the DNS that day. And then other topics of ENT, because when it gets the teacher compliments you that maybe you know something other than the other students, so you start by learning something. So that is what I did. I started watching videos, then I read notes maybe the morning before my class, and in the evening, just to test my knowledge, I also practiced a few Q bank questions also, just to test my knowledge. And because everyone kept saying that MCQs are the deal in FMG, so I tried. All right. So the next main thing, I cannot emphasize this enough, anything that really helped me is building concepts. I took my very sweet time building concepts. Okay, it I started with pharma and path. That is what I also recommend to anyone listening. Starting with pharma, path, and physio really helped me because these three form the building blocks of medicine and any other clinical subjects thereafter. So I took about like the whole year, whole fourth year, fifth year, reading just pharmacology. I took 10 months reading this and 9 months reading path. These subjects do not need that much time because I was not consistent. So it took this much time here. But that is what I would recommend as well, not to take a lot of time like me, but building concepts is very important because you will not be able to integrate any subjects if you don't read, build your concepts. Yeah. I also stuck to one source. I'm not saying that if you buy one subscription, you should just stick to it, but you should give it a try. And once you understand any teacher, then you should not change your source. Also, if you do not understand the particular teacher, you should not hesitate as well, because hesitate to change the source as well, because if you're not understanding only, then what is the point, right? So sticking to one source really helped me because we get a lot of FOMO that maybe the other teacher would be teaching some other concepts, and we hear a lot of things that this subscription is better, this platform is better, but at the end, it's just the same content. Every teacher is teaching the same content. It's all the same, all same questions, and no one is teaching anything extra. So stick to one thing. Yeah. Anything but stick to one thing. Yeah. All right. So my overall preparation strategy was this, that I started with main videos. This is very important. Okay. I've heard all of, university may, a lot of students said that you should just do RR in the last 1 year or 6 months, But I did not feel that way, because just reading RR, I had to read the whole thing. I had to learn the whole thing. And that was not my cup of tea. I would rather learn main videos, watch main videos, and learn those things, main videos, and learn everything that the book has to offer. But I would rather just, learn the gist of the thing mainly. And I would want to maybe skip a few things also. The main videos give you that option. RR don't. RR may you have to study everything. So that I think I recommend this. If if you have the last 6 months, then of course you cannot watch main videos for all subjects right now. You have to stick to RR, and that is what will help you. But if you are in your fourth year, fifth year, third year, whatever, then you should stick to main videos. I do not recommend anyone to start RR before the last 6 to 8 months. Yeah. Okay. So multiple revisions of RR. This is when you are in your last 6 to 8 months. When you are in the last 6 to 8 months, RR is your gold standard. You just have to study RR. Give it minimum 3 revisions. Okay. I studied for once. One time I covered my whole syllabus. And then for my second revision, I stuck to RR again, but this time it was revision. Okay, so I was not watching all videos, not all RR videos. I was just sticking to revision of mainly the notes. But there are some places that you feel that your notes that you're not understanding, and you're not able to recall where you had studied this. So at those times, I believe RR videos are very important, because that is the whole point. If you're not able to recall from notes, then videos are the whole point. Then in the third revision, I stuck to LRR in the last 1 month or last couple of weeks. I stuck to LRR. And because, they help a lot during active recall also. Then there were so many days, I did not even count. There were so many days that I did not feel like studying at all, because we came back after so long, such a long journey in abroad, wherever you were, wherever I was. It was such a long journey that you come back and you feel that this is what you have to do now as well. Parents are so happy that you've become a doctor finally. But um, it gets sad sometimes that everyone has moved on. Your school friends have moved on. They've started earning and everything. But it does not feel very nice. It did not feel very happy for me to just study for 6 to 8 months, you know. So those days I stuck to reading flashcards. I found flashcards in the PrepLadder app also. So that is what I did. I would finish a subject like medicine, or maybe like start with biochem. Okay, I finished biochem. Then I did not feel like, reading notes sometimes, because that was the most boring part for me. Notes I do not like. Okay, so I stuck to, because before you read notes, you cannot go to QBank, because questions get very wrong, and then you get a percentage of 50 to 80%. And then you feel bad that I spent so much time reading notes and watching videos, and now I'm not getting any marks. So what I did was read flashcards. They actually help, because they help you active recall. They help you recall everything that you've read in notes, if you have or if you haven't, and whatever you've read in videos also, to using flashcards. They help you recall. You see the topic, or you see a question in the first line, and then you flip it over and it reveals the whole answer, explanation. It gives you a sense of that you know a lot of stuff, without actually getting marks and feeling bad about it, that maybe I could not solve this question. I got confused in a couple 4 options. Flashcards do not have 4 options. They just have an answer. So they ask you one simple question. If it clicks, then it clicks. Otherwise it doesn't. So that is what I did on days I did not feel like studying at all. Then watching integrated videos. This actually helped this exam, because there were so many integrated questions. The question would start with a 6-liner medicine question. And then at the end, it would ask the mechanism of action of the drug that would be used in the diagnosis. So there were 3 layers. First, you had to understand the whole medicine thing, make a diagnosis. Then you had to, from the diagnosis, you had to go to the treatment of the situation, and from the treatment you had to go into the class of the drug, and you had to guess the mechanism of action. So there were so many layers, and getting it right in 1 minute, under 1 minute, in the conditions of the exam hall was very difficult. So I believe watching integrated videos will really help once you have completed the first revision. Okay, it's very important to cover the syllabus first. Watching the integrated videos in the first half itself will not help. Syllabus completion is very important before you move to integrated videos, because otherwise you will not even understand what they're trying to say. You have to complete the general things first. Complete the whole syllabus, whole subject syllabus first, and during the second revision, go to integrated. That is what I did, and that is what I recommend as well. Okay, so there's a daily streak in almost, I believe, all apps, but I use PrepLadder. So I had a daily streak of about 300 days at the end, and that helped me because when you see that it's going to get lost, the whole streak, that you'll have to start from day zero. It genuinely helped because I got some motivation to solve at least 50 questions from the Q bank. Solve how many questions from the Q bank, or just watch a video passively also. It really helps on days that you don't feel like studying anything. So yeah, daily streak is what keeps you accountable, I believe. Then the next thing, I relied on grand tests heavily. I gave about 2 to 3 grand tests a month, every month. And I believe that really, really helped because it helped me, sit in the exam hall. It's very hard, sitting for that long in this much heat, and switching your brain between questions. There are a lot of things. But yeah, I relied heavily on grand test. I too got scared, very scared. But this is very important. Yeah. Okay, moving on to the resources and study materials I used. Resources, like I said, I had a PrepLadder subscription, and but whatever subscription you may have, whichever teachers you're reading from, whichever platform, the thing you should mainly follow is video, then notes, then QBank. What I did was I came back from my university. In the evening, I started watching a video or two. However many I could watch in one go. It was not like I watched a video, then I read the notes. No, because I tried that, but I felt that when you start reading notes, uh, at the same time, just you finish the video and you start reading notes, everything is fresh in your brain, and it feels like I know everything, that I remember everything. So what I did was I watched videos in the evening, and then the next morning, I maybe depends on your classes, but when I had a class at like 12 p.m., then I got up at 8 and read the notes for the videos I watched last night. And then I went to class, and then I came back and followed QBank topic wise. Whichever videos I watched, I would uh, solve questions that for that QBank, that topic wise. This is what I did during university. This is not what I recommend during the last 6 to 8 months, the stretch of 6 to 8 months. This is not what I recommend. I think this works in university only because you're taking such a long time to complete a single topic. You can only have this when you are in university. In the last 6 to 8 months, you just have to rely on rapid revision. So I completed major subjects, not all, but the building blocks, like I mentioned before, pharma, physio, and path, I completed from main videos. Also, all major subjects like medicine and PSM and OBG and surgery. This is what I completed from main videos. All right. And I left not all, majorly all subjects for RR. Okay. I had about 8 to 9 subjects that I had not even touched before 4 months. This consisted of a lot of intermediate subjects as well, like anatomy and biochem, and also a lot of shorter ones like the short 5 we have, derma, psych, and everything. So I just used rapid revision for those. Then practicing subject-wise 50 PYQs every day. I would highly, highly recommend you to do this. Because what we feel is if you're watching videos for maybe like physiology, for example, and we completed a nerve muscle physiology this day. So tomorrow, what sometimes I did was to solve topic-wise questions in the Q bank, but that took so much time. So what I switched to and what I feel is best for someone who's in the last 6 to 8 months is to practice 50 PYQs. Okay, it does not matter which subject you have read today, which topic you have read today for that particular subject. Just wake up the next morning and completely take like FMG, any exam, previous year exam, and subject wise solve 50 PYQs for that. Even if you don't know the rest of the topics, even if you score very low, you will just get an understanding of the pattern of the questions that they are asking. And in the evening, when you read that subject, read that topic again that you got wrong in the morning, then it will really help you to know that what kind of, what should be your strategy to read the notes and, just to apply that knowledge. So it would really help if you did 50 PYQ subject wise. All right. Taking subject tests and mini tests every 2 to 3 days. Like I said, I took a GT every 2 to 3. I took 2 to 3 GTs every month. During the rest of the week, what I did was I could not solve PYQs every day. I could not solve 100 questions from a custom module every day. Sometimes what I did to, get better at time management and for clinical questions as well, because when you give subject tests and mini tests, you get clinical questions, about 20 to 30 clinical questions, and then you take a test and 50 to 30 questions are done. So you just have to do another 100 or whatever for that day. Okay, so I feel subject tests and mini tests are very underrated, and everyone just talks about grand tests, but I believe subject tests and mini tests are very important also, and they would really help, to just get a test-like feel for a particular subject. Because in grand tests, you have to switch your brain so much between subjects that you cannot get an understanding of that particular subject that you've been reading for the past few days. But subject tests and mini tests really, help you get an understanding. Okay, so how I approach different subjects and high yield topics. All right, for subjects, I would say a roadmap of building basics with, again, pathology, physiology, and pharmacology before jumping into clinical subjects my medicine. I started medicine before also, when I had not read pathology. I started by watching a video or two. I could not understand anything. I just gave up and I stopped studying for 2 months straight. So I got some motivation again. And then I started by reading pathology from Preeti ma'am. And yeah, so pathology, physiology, and pharmacology are the basics of medicine. That is what you have to study before you jump into medicine. And OBG also, OBG you can also study before this, but I would still recommend you to get a basic understanding of these three subjects, because any clinical subject that you read will have the treatment and the drugs. All right, so you have to know pharmacology before you jump into any major subject. Also for physiology, if you don't understand the hormone endocrine thing, that you cannot go to OBGYN, you will not understand gynecology. And but for pathology, of course, you have to know, tumor markers, and there is so much vast knowledge that you need to that you will get from pathology, that it would be so easy to go into medicine and OBGYN. And they're just called the basic building blocks because they are. They would really, really help. So this is what I would recommend. I would say even if you have read these subjects before, you know everything from these subjects, I would still tell you to brush up on knowledge from these three subjects before jumping into medicine. Even if you know every single word, I would still tell you to, brush up before you jump into medicine. It would make it really, really easy. All right. Compensating, anything I did not understand through rapid revision using main videos. Like I said, I stuck to rapid revision in the last 6 to 8 months. But anything I did not understand from rapid revision, because for clinical subjects mainly, they are not very huge rapid revision videos. And like for a subject, I would say, like for example, OBG. Okay, if you do not understand the whole antenatal and the cesarean section, when do we do cesarean section, and that sort of clinical questions, then you would not get those questions correct, because there are 4 options that are very close to each other. So for this thing particularly, I remember I used I use main videos. I watched them because I did not understand the whole concept from RR. And I also used to think that if I switch to main videos so often, then I would not even complete my syllabus. But for FMG, you don't need to complete the whole syllabus. Of course, you have to do RR videos, but not everything is super important. But like everyone says, that PYTs are very important. So PYT, this type of question is a previous year topic. This question comes almost in every exam, be it NEET, PG, or FMG. It comes in every exam I've seen. And to get a question like this correct, your concepts have to be clear. And for me, it felt that they got clear when I watched main videos. So do not be afraid to go back to main videos even if you are in the last 3 months. Just watching for half an hour would not take a lot of time, but it would clear your concepts. So there's a lot of pros more than cons here. For high yield topics, I give multiple revisions. High yield topics are usually the ones that cover a major chunk of RR. So these are the high yield topics. Also, the PYTs, you could check out any exam, and you would just at a glance also you would understand the PYTs. What are the previous year topics, and what is being asked, and what type of questions are being asked from this. Then you make a list and just give those topics multiple revisions. When you start doing 100 to 150 questions every day, you would understand yourself only that which topics are high yield and which topics, if you give about 2 to 3 hours to those topics and you can solve 10 to 12 questions, then those are high yield, of course. So that is what I did. I gave them multiple revisions, about 2 to 3, and I also focused on them during the LRR revision also. Active recall was, of course, the main thing, the PDF that you get from the YouTube session, and you fill it completely yourself. That is what I did, active recall from that, the empty PDF, and I would fill it on my own. And then gave it multiple revisions by maybe solving a lot of questions and revising it a lot of times. I also put tags at the end. I put tags in my books that help later on. I studied them about 2 to 3 days before the exam. So, right. Okay. So my daily study routine and time management. Okay. I would be very honest here. I am not a morning person at all. It took me a lot of time to get into this habit. I was the person that would get up at 2 p.m. every day when I came back to India from vacation and everything. And but here, I saw when Dr. Deepak Marwa told that you have to be alert at 9 a.m. because that is when your exam is. You just have to be alert. Do anything, wake up at 5, wake up at 6, wake up at 8, whatever you want, but you have to be alert at 9 a.m. I stuck to it. I fell back to my patterns a lot also, but I tried, really tried, and I woke up at 7. I tried waking up at 6, I could not do it. It was not possible for me at all. So I woke up at 7 and I would be at my desk in 30 minutes. I would just go get up, freshen up, take a walk, have a cup of coffee, and be at my desk in 30 minutes. At 7:30, it was a rule that I had to solve 100 to 150 MCQs. First thing in the morning, practicing 100 to 150 questions first thing in the morning was very, very important because, I felt that it makes your brain so much alert when you go right into problem solving mode the first thing you wake up. I felt super sleepy. Even after 3 cups of coffee, I would feel super sleepy because I am not a morning person. I could not wake up. But when I went into the whole MCQ situation, when I tried solving questions the first thing in the morning, that would force my brain to wake up. And it made me so much more alert. And I'm very thankful to Marwa sir for this because his words really helped me with this. And when I was at that exam center, my brain was super alert because, first thing is adrenaline rush you get when you go to the exam center. But to, actually focus at the questions what you're reading, adrenaline also gives you a lot of anxiety. So, it was very hard to read all the questions in one go and get the answer because they were very twisted this time, but it made my brain really, really alert. So I would recommend anyone and everyone to wake up at least by 7. If you're a morning person, then great, you wake up at 5 and whatever. But I woke up at 7, and I don't think it's really necessary to wake up before that because you get quiet time at home only after 10 p.m. when everybody sleeps. So that was the situation at my house. So I woke up at 7, stayed up till 11 or 12, and then 7 again the next morning. All right. So solving 100 to 150 MCQs took 2 to 3 hours. At the start, it also took about 3.5 hours for me because, sometimes when you solve custom modules and PYQs, there are very huge questions and it takes your brain so long and you get so exhausted and burnt out after that, that it took me 3.5 hours also some days. But during the end, in the last 1 month or so, it took me about 2 hours, also 1.5 hours sometimes, to solve this many questions. Your brain gets adapted to the whole situation of it. You get into a habit of solving questions. Your brain goes into focus mode the moment you see a question with 4 options. It just clicks sometimes. So practice will make you perfect. Okay, then after that I took a 1 hour break, breakfast and a walk and whatever, and then I started by watching video lectures. Okay, so the first thing in the morning for me was question bank, then I went to video lectures, then I went to notes at night. This worked for me because naturally I get more alert at night. I had to force myself to be more alert in the morning. So that is when I started with MCQs. This forced my brain to be alert. If I had to read notes first thing in the morning, I tried this as well, but I just used to sleep. I would not understand anything what I was reading. I would read passively and then go off to sleep. So I put notes last thing in the night before sleeping, because still then my brain was even alert, because this is how I've been functioning all my life. So I read notes last thing before sleeping, and a video after question bank, taking a break. I watch video lectures, then followed by another break for maybe lunch or a walk again, talk to your family, and I finished the day with reading notes for the lectures, for all the lectures I watched during the afternoon phase. I used to, again, the same thing I followed before, but then it was video notes question bank. This time it was during the last 6 to 8 months, it is Q bank videos and then notes. I went to videos later on because, I had to make my brain alert first thing in the morning. Then for videos, I watched as many as I could in one go. Because like I said before, if you just, watch the video and then open the notes, then you will not completely understand what's going on because your brain still remembers the video. So I would take a large break of 2 to 3 hours sometimes in the evening, and then I would go back to notes. Some things do not get retained, and then when you read the notes, actually, you put your hand over it and you try to recall. That is when you really understand what was going on in the video, because you don't retain as much as you would if you would open the notes right away. Okay. So every other Sunday, like I said, I would take a grand test and analyze it the next morning, because every other Sunday, so about two to three I took sometimes, two GTs, and I would take a grand test. And when they're live, you do not get the results till, 12 a.m. at night. So I would analyze it the next morning. And to be very clear here, the maximum, okay, please keep this in mind, the maximum hours I studied was 8. Actually, what happened was 5.5 to 7 to 8, yeah. So I also stuck to 5.5 some days when I was burnt out, when I did not feel like studying, when I was sad, when I did not get a good score, whatever. And then the maximum, when I had complete full motivation, I went to 8. Not more than that, never. That did not work for me. And I would still get burnt out and take a break in 8 hours. Like I said, I would study for 8 hours one day, and the next day I would get so burnt out, I did not feel like studying at all, and then I would study 5.5 hours. So, this switch happened. I believe it happens with everybody. You cannot stay consistent every day for 8 hours, every day for 9 hours. You will get burnt out, at some days. And I believe it's very, very important to take a break. You should not feel guilty at all. I also felt guilty, uh, and you to take a break, but you really deserve it. I deserved it. Everybody deserves it. We have worked hard. We have been working hard for 6 to 8 months, and we deserve breaks in between. We have been outside India for so long, and we've been missing a lot of things. So take breaks when you burn out, because it really becomes counterproductive otherwise. And it becomes counterproductive, and you don't really understand what's going on because you study just passively, right? And when you watch videos, and because if you're burnt out, you cannot retain the notes that you are reading. You will just be reading them passively, but passively पढ़ रहे होते हैं, and it really does not help उस time पे, because your brain feels like it's studying, but nothing is really going in your brain, and you don't even take a break, so it's not replenishing your energy, and it just becomes counterproductive, right? Okay, so how to utilize a break? Do things that replenish your energy. Social media scrolling will not help at all. I tried. I was an Instagram addict as well. I used to, have a screen time of 8 to 9 hours at some days. Not during this phase, but yeah, in university I had about 8 to 9 hours at some days. I was also social media addict. And but this time what I did was, I did things that replenish my energy, taking a walk, walking my dog, and watching Netflix and listening to music, good music. Yeah, that really helped. I and I would really like to say, don't isolate from yourself from the world. It's not like you have to be stuck in one room, पूरे दिन दरवाजा बंद करके बैठे रहो, and don't isolate yourself. Talk to your family. You've been here after like 6 years. Some people have been, and your parents are so happy that you finally graduated, become a doctor. उनका बच्चा doctor बन गया है, and they really want to show you off. So just sit with your family. Go to family gatherings also. Manage your time, right? Don't just sit at your home all day. Manage karo. You'll get wedding invitations. Go enjoy your wedding. We have not been to weddings so long. We've missed everything. Eat outside food. We really missed it. I did. And I think everyone should, get a good break. At sometimes taking 1 or 2 hours off every day will not be the end of the world. It would really help you. It really helped me. Take breaks, go to weddings, eat food, meet your school friends, get their stories. The world is not stopping here. It's not stuck. We are. So, be involved in politics, go read the newspaper, whatever, makes your brain happy. All right. So how I practiced MCQs. And I use PYQs. Like I said, my approach to solving huge MCQs was, you know, when a question has about 6 lines, okay, you get very overwhelmed. So what I did was I read the 6 lines in one glance. Okay, not everything. I read the first line, जिसमें vitals होते हैं, and you get lab values also. Just quick glance, because of course you don't remember every value, right? So quick glance. उसके बाद 4 options हैं. Read those options. Just a glance, okay? Then you get some idea of what the question is asking based on the options also. That is what helped me, क्योंकि मुझे ये समझ आता था that if the question is asking these 4 options, तो ये question किसके बारे में बात कर रहा है, which topic is it addressing to. So then I would go back to the question, read it completely. The last line has the major chunk. Reading the last line completely and then glancing over the other ones also. Then I would choose that option that yahi answer hai, and that is what would help me. I did not go to options first because उसमें अब हमारा brain confused हो जाता है. I felt कि ये 4 options हैं तो यही आंसर होगा, ये वाला आंसर तो होता ही नहीं है, ये हो नहीं सकता. That thing we get into. So this helped me, and I would really advise you to do this as well. Take a glance of the question first, then the option, then go back to the question. Okay. When you solve so many questions, it gets so hectic to read all explanations, but they are really necessary. I did not like doing it at all, but it was important. That is why I'm saying it now. I solved 50 subject-wise PYQs, like I said before, 50 questions if I'm studying physiology today. Then the next morning, I would do 50 PYQs for physiologies from any past paper. Pick up any FMG paper and solve 50 PYQs for that. Then I solved 100 questions from a custom module where I chose all 19 subjects. It did not matter how many subjects I had read till date. If I had only completed 3, 4, pharma, physio, medicine, path, OBGYN, surgery, even if I had read like 8 subjects, I would still make a custom module for all 19. This gives you a pattern how the questions are being asked. You would, of course, not be able to solve it all. You will not get good marks in that custom module as well. I have also gotten 20, 30%, 40%. And I did lose my motivation, but it really helps when you solve questions from all 19 subjects. You get an idea of how to approach the question, and it gets you the habit of switching your brain between other subjects also. Okay, so reading all 4 options for PYQs is very necessary. I did not like doing it because it takes a lot of time to read all answers, read all options, then make up questions for those answers. I'll explain better with an example. Okay, so here we have a 32-year-old pregnant woman in the 3rd trimester presenting with sudden severe abdominal pain. Okay, it's sudden onset, also followed by slight vaginal bleeding. She appears pale, restless, and her pulse is rapid with hypotension, disproportionate to the amount of bleeding. Okay, it's disproportionate to the amount of bleeding. Uterus is tense, tender, rigid, and fetal heart sounds are absent. Okay, in the first glance only, and then I would read the options. Okay, abruptio placenta, placenta previa, polyhydramnios, missed abortion. Now I know what the question is trying to ask and how it's trying to confuse me. Okay, so what I would recommend is you highlight the buzzwords like I did: sudden onset abdominal pain, disproportionate to the amounts of bleeding, tense uterus, tender uterus, and fetal heart sounds are absent. The answer is clear here. It's abruptio placenta, right? Because there is sudden onset of severe abdominal pain. Now, how to rule out other options, right? In placenta previa, you do not get severe abdominal pain. Okay, it's painless bleeding. You can get a hypotension in placenta previa, but there is no tense uterus, tender uterus. It is painless bleeding. Okay, so this is how the question is trying to confuse. It's giving you an option where you can think placenta previa, but it's also giving you things where it is not possible to have that option. Okay, the next one is polyhydramnios. Fetal heart sounds can be not absent, I would say they would be very faint because there's a lot of fluid, but the uterus would not be tense and tender. Okay, you will not have sudden onset of severe abdominal pain. So that is how you rule out polyhydramnios also. Then there's missed abortion. Now they're trying to confuse us with missed abortion with vaginal bleeding. There is slight vaginal bleeding. That is what happens in missed abortion. You know, vaginal bleeding is the thing that we focus on. But again, here the uterus is tense, tender, and they have not mentioned anything about the ultrasound, the TVS ultrasound, or the closed cervical os or anything they have not mentioned here. So that is how you rule out that. Now, getting a question right like this is, sometimes they would not repeat PYQs, but they would repeat a question like this. They would just change a few things in the question, have the same 4 options, and then you will have to choose one of them. So how this would help, ruling out all options is just like I said, that if you have to make up your own question. When you solve a question like this, you get the answer in the first 1 minute. Then you try to read how the placenta previa thing, make up a question like, अगर ये ऐसे पूछा होता कि there is just vaginal bleeding, no severe abdominal pain, then you would have to think about placenta previa. Agar siraf fetal heart sounds would be faint, then you would think about polyhydramnios. If the USG TVS was mentioned, you would think about missed abortion. You have to make up your own question for the options they're providing. That is what I would recommend. All right. So what was my revision strategy? I divided into 3 phases. All right. So the first one was 3 months, then it was 2 months, then it was 1 month. This is where I completed my syllabus, the subjects I had not read before. 2 months were the faster revision of the same procedure. Okay, I would just subtract 3 days from the duration of the whole subject. Then the last phase was the YouTube LRR sessions and active recall on empty PDFs. I would just listen to the whole lecture, and then I would get the blank PDF of the lecture and fill it up on my own active recall. And then check it from the PDF that has everything written in it. And this is very important, 100 to 150 questions every day. I started with 100, moved up to 150. I would not recommend to practice more than 150 questions, because if you do this the whole day, then when will you study? You have to apply your knowledge. You just don't have to test it. Because if you don't have any knowledge, where will you apply it? So just don't do more than 150 questions. Practice all type of questions, one-liners, clinical ones, integrated ones. Get a whole variety and do not solve more than 150. Importance of grand test. I was so scared in taking my first grand test because I had read like 3-4 subjects, but it gives you a real sense of exam simulation, and you understand how the exam is going to be, and you have to sit there for so long without moving, without any breaks, without taking a breather, anything. You just have to sit there, and you have to just take a lot of time in getting yourself into the habit of answering so many questions in one go. And then GDs really help you identify your weak areas, that it gives you the analysis, like which were your weakest subjects, which were your strongest subjects. It gives you an idea of which your weak areas are. Like if you've just studied OBG and you scored like 10 marks out of 35 in OBG, then of course you have to give it another revision. You have to see which you have to see which things were lacking before, which kind of concepts you did not understand, and then read it again. If you do not do this, then you will just believe that OBG khatam ho gaya, and then you'll move on to another subject, but you will not get a good sense of what you really understood and how you apply it to questions, right? GTs give you a habit of switching between subjects. When we just do like 50 PYQs, then we somewhat know that if I'm doing physiology, then the answer is going to be related to it. If I'm doing medicine, then the answer is going to be related to it. But when you take a GT, you get a question from biochem, then you get another question from anatomy, then you get a question from psychiatry. So, your brain has to adapt to switching between subjects in like 5 seconds. So this is what will help. GTs will really help in this. Time management, of course, I put a target for myself to solve every question in 45 seconds, not more than that. Because in exam, there will be such long questions that it will take you a lot of time. And keep about 5 to 10 minutes at the end of every section. Don't move forward. 5 to 10 minutes at the end of every section to take a breather. Don't revisit anything, but to take a breather at the end of this. So 45 seconds max. Do not take more than that. Pattern recognition, of course, you will get a sense of how the subjects are being asked. Then do not overdo it. Do not give a GT every 2 days, every 3 days, because you will not be able to analyze it. Then it will be counterproductive, because you will not know what you are lacking, what kind of questions you're getting wrong, and you will not be able to study. You will not get time to study if you give a GT every 2-3 days, right? Then mock test strategy and analysis. This is what I got from Preeti ma'am. And I'll just be sharing a brief of it because you should watch her video. I watched her video. I would recommend you to watch her video. She explains it so beautifully. And this is what helped me, okay? So I give 2 grand tests each month, 1 live. You get 1 live test every month, right? So I gave 1 live test and 1 past exam, or any previous GT if I did not want to give a past exam. All right, then I would analyze it subject-wise, strongest to weakest. I would divide the questions into 3 categories: corrects, guesses, and incorrects. 3 subcategories under the incorrects: silly mistakes, recall issue, and lack of knowledge. All right. So recall issue and lack of knowledge. Silly mistakes were the best place to be. That was what Preeti ma'am told. And that is what I believe, because you can, correct silly mistakes thing with just observing more, just being more alert. But when you have recall issues or lack of knowledge, you just have to read the whole subject again. So, silly mistakes are the best place to be. Read all explanations, even the correct ones, just at a glance, okay? I'm not telling you to spend like 3-4 hours reading all explanations, just at a glance to see that what you thought while answering the question, was it correct or not? Yeah. All right. So you get make a list of your bottom 5 subjects. When you do this in a notebook, you will get an idea what your bottom 5 subjects were, and focus more on these subjects during the next revision. That's it. I kept a record of every grand test. I have a notebook, and I use that notebook to analyze every grand test. And then I would compare, every other answer. I would every other test I would, to keep a record and to see that if am I improving, or are my bottom 5 subjects improving. Then some common mistakes to avoid are being afraid of taking grand test. In this slide, I've just comprised of the things that I was scared of. I made these mistakes, so I would just like to say that do not make these mistakes, learn from me. And don't be afraid of taking grand tests. They do not decide your actual score. You just have to get into the habit of solving questions this fast and this alert. And the main thing is that you have to be equally attentive to the 150th question, just as you were to the first, because they comprise of 1 mark. And even if you're tired on the 150th question, it would still give you 1 mark. So you have to be just as attentive when you were at the start of the exam, at the end of it. Do not change sources too often. Do not get in the FOMO of the thing that other teachers are teaching better or they have more content. Everyone is teaching the same content, same exam. Living with the fear of missing out. Other sources are not providing anything else. Stick to 1 source. Studying for more than 10 to 12 hours a day. I did 8 maximum. I would not recommend you to study more than 10 to 12 because you'll just be studying passively and you will not understand anything at all. taking too long reading explanations. I did this. I'm guilty of this. I took about 2 minutes to sometimes 5 minutes also reading an explanation. But when will you solve other questions then? When will you gather more knowledge to solve more questions the next day? Just take a minute or a minute and a half. Do not take more than that. Okay. Do not take too long reading explanations. Then, tips and advice for first-time FMG aspirants would be to focus more on high-yield subjects. Do not spend 5 months, 10 months on anatomy and biochemistry. Even if you understand the whole medicine of it, it would only comprise of 10 to 12 questions. Focus on the high-yield subjects like medicine, surgery, OBG, and PSM. They are called major subjects for a reason. They comprise of 30 marks. 30, 30, 30. It would call 120 marks if you get all of this right, along with some questions from intermediate and minor you pass. Okay. So just build your basics with pharma, path, and physiology. Then jump into medicine, then go to OBG, surgery, PSM, work your way like that. There is no point in collecting knowledge if you won't learn to apply it to questions. 100 to 150 questions. I have been repeating myself for the past 45 minutes, but these many questions are genuinely important. There is no point in collecting information, reading notes, rereading notes, watching videos 3 times if you do not learn it to apply it to questions, because at the end of the day, that is what you have to do. That is what you have to do in the exam. Even if you can explain the whole topic to your friend, if you do not have the knowledge to have the practice of applying it to questions, then of course you will not get a good score, right? Make a realistic timetable. You cannot study for more than 3 hours. 6 घंटे का मत बनाओ एक बार में. 6 घंटे नहीं कर सकते हो. All right. 3 घंटे का करो. Take a break. Do not feel guilty taking breaks. Give heavier subjects the time they deserve. Okay. You cannot finish medicine in 2 days. It is not possible. नहीं कर सकते हो ये. Just give heavier subjects the time that they deserve. All right. Medicine को ज़्यादा दिन दो. Surgery, PSM. Give them the time they deserve. Right. Neglecting image-based questions such as PSM, radiology, pathology, dermatology. This exam had a lot of image-based questions. Video ones were also introduced, but they were not so difficult. But still, you had to know images if you have to answer those questions. There were about 20 plus questions, I would say, together, video and image-based, but you have to. About 2 to 3 days before, glance over all the images, important ones, and PSM ke logos, radiology, chest X-ray, CT scan, pathology slides of tumors, and then dermatology, because you will get a idea of what questions are being asked. If you see the image and you're able to identify, even if the clinical question, the theory of it does not help you, you will still get the question right? And also for ophthalmology, yeah. All right. So I would like to end this by saying that this exam had a very low pass rate. Okay, it was like 12%. This did not happen because the students did not study. It was very unfair. Of course, it was. The examination, you had to sit in the heat, and it was very difficult to sit there for so long. There were no fans, no coolers. Okay, this exam has a very low pass rate, but it was not because the exam itself is difficult. Okay, the content is same. You have to learn to apply all the knowledge that you gather. Do not let the stats scare you. Okay, it was 12%. It does not mean that you will be in the 88. It does not mean that. You can be, of course, you will be if you study. Okay, you will be in the 12%. FMG, it is a test of recall and MCQ practice. You do not need to have deep clinical knowledge like USMLE exams or anything else for that matter. It is just recall and apply. Okay, you just have to recall everything that you've learned again and again, multiple revisions, and then you have to do MCQ practice just to apply that knowledge. That's it. You do not need to study for so many hours. You do not need to have clinical exposure. People think that we've not been in hospital posting so much, so we cannot pass or anything, but of course we can. It is not a test of deep clinical brilliance, and you do not need to cover everything. Do not get into the FOMO that I have to study from main videos only. I will not go into RR. They are called RR for a reason. They are rapid revision and they are high yield. That is why, they have been made, of course. Repeated revisions of the high yield content is enough. It is more than enough, I would say, to make you pass the exam, because that is what I did. I scored well, I believe. And yeah, like I said, I did 8 to 9 subjects from RR. Okay, please do not let the stats scare you. Okay, you will pass. Of course you will. Okay. I would like to say good luck. And Yeah, I would also, if you have any doubts, of course, I'll take them right now. Okay. 36 questions, but you get 12 MCQs right every time. That's not bad. Of course, it's not bad. 36, you do 36 questions and then you get 12 right. Okay, try doing about 100 to 150 and see how many you get right then. It also depends on the on the subjects that you've been using. If you've been getting this many marks in 19 subjects, then it's not bad. It also depends on which month of preparation are you in. Okay, you will definitely improve once you start doing a lot of questions every day. All right, thank you. Okay. Of course, it ऐसा ही लगता है GT के end में, at the end that 50 minutes, the last 50 minutes are the hardest because उसमें थक चुके होते हैं, brain बिल्कुल exhaust हो गई है, कुछ समझ नहीं आ रहा है. But, you have to. करना ही पड़ेगा, उसके अलावा क्या ही ऑप्शन है. तो प्रैक्टिस करोगे ना बार बार जीटी, गिव वन जीटी, डू सेकंड वन, थर्ड वन, अबाउट एट योर 5th to 6th जीटी यू विल गेट इनटू द हैबिट कि अब करना ही है, खत्म हो बस किसी तरह. दैट इज व्हाट आई फोकस्ड ऑन कि ये खत्म हो बस किसी तरह, उसके बाद आई विल टेक अ ब्रेक ऑफ 2 hours जैसे एग्जाम में होता है. तो बस पहला 50 मिनट्स आर द इजीएस्ट क्योंकि वो हो जाते हैं, उसमें मोटिवेशन होती है. सेकंड वाले में फिर भी थोड़ी सी मोटिवेशन होती है, लास्ट वाले में थक चुके होते हैं ना. तो लास्ट वाला जो सेट आएगा उसमें बस ये सोच के चलो कि अब खत्म होने वाला है, किसी तरह निपटाओ इसको और ब्रेक लो. ओके, और प्रैक्टिस करते रहोगे तो आदत पड़ जाएगी. या ऑलराइट. Out of 150, I got 80. Is that a bad mark? This is my first month of preparation. Of course, it's not bad. It's very good. Out of 150, if you got 80 marks, that is not bad at all. And it's your first month of preparation, first GT. You've been scoring so much better than everyone I've ever heard. कभी मेरे तो कभी भी नहीं आए इतने. You've been doing so good. Please don't ऐसे मत सोचो कि नहीं होगा, आराम से हो जाएगा. फर्स्ट जीटी पे ही इतने अच्छे मार्क्स आ रहे हैं, धीरे धीरे इंप्रूव होंगे ना. ऑफ कोर्स व्हेन यू विल बी स्टार्टिंग मोर सब्जेक्ट्स, यू विल गिव देम मल्टीपल रिविजंस, रोज एमसीक्यूज करोगे तो ऑफ कोर्स हो जाएगा, आराम से हो जाएगा. ऑलराइट, आई थिंक दैट्स इट. Reviewing MCQs and PYQs taking too much time. I emphasized on this. अगर MCQs पढ़ने में, PYQs करने में, explanations तो पढ़नी देखो necessary हैं, पर उनमें 1 मिनट 1.5 मिनट से फालतू नहीं लगाना. 2 2 मिनट 5 मिनट अगर लगा रहे हो तो फिर आगे के क्वेश्चंस कब करोगे, है ना. व्हेन विल यू स्टडी बाकी के सब्जेक्ट्स अगर यही करते रहोगे तो. ओके. तो टाइम लगता है, धीरे धीरे प्रैक्टिस करोगे, अपने आप एक हैबिट में आ जाओगे कि फटाफट एक्सप्लेनेशंस पढ़ लोगे. जैसे क्वेश्चंस को एक ग्लांस में देखते हो ना, वैसे एक्सप्लेनेशंस को एक ग्लांस में देखो. क्यू बैंक और कस्टम मॉड्यूल, लाइक आई सेड, 50 क्वेश्चंस PYQs करो. दिस इज व्हाट आई एम रिकमेंडिंग लास्ट 6 to 8 months में. ठीक है. और 100 क्वेश्चंस कस्टम मॉड्यूल, ऑल 19 सब्जेक्ट्स. ठीक है, ये वाला करना है सब्जेक्ट वाइज. इससे हो जाएंगे 150 क्वेश्चंस, और ये करना है बिल्कुल लास्ट स्टेज पे. उससे पहले 100 पे स्टिक करो, 80 करो, ऐसे धीरे धीरे बिल्ड. क्योंकि सीधा ही वो करोगे तो इट विल बी हार्ड, सीधा जंप नहीं कर पाओगे. ऑलराइट, सॉरी. 85 out of 300, तो अभी प्रैक्टिस करोगे तो आएंगे ना. और ऑफ कोर्स अभी 85 आ रहे हैं, यू विल प्रैक्टिस मोर ऑफन, यू विल गिव मोर जीटी, स्टडी मोर, गेट बेटर रिविजन, ऑफ कोर्स विल गेट बेटर मार्क्स. आर देखो, आर इज सफिशिएंट. आर इज सफिशिएंट, पर इसका मतलब ये नहीं है दैट इफ यू हैव अ लॉट ऑफ टाइम, जैसे अगर आप अभी 5th ईयर में हो या 6th ईयर में हो, तो भी आप आरआर पे जंप कर जाओ. आई वुड नॉट रिकमेंड दैट. तब देखो, लाइक आई सेड, 6 to 8 मंथ से पहले आरआर को टच ही नहीं करना है. इट इज कॉल्ड रैपिड रिविजन बिकॉज इट्स फॉर द रैपिड जोन, दैट इज 6 to 8 months. उससे पहले सिर्फ मेन वीडियोस पे ही फोकस करो, बिल्ड योर बेसिक्स, सारे कॉन्सेप्ट अच्छे से रिवाइज करो. ऑलराइट. हाउ टू रिवाइज ऑल 19 सब्जेक्ट्स, देखो इसके लिए आपको पूरा स्केड्यूल बनाना पड़ेगा. मेक अ स्केड्यूल ऑफ ऑल 19 सब्जेक्ट्स. पहले 3 महीने में कवर करो सारे ऑल 19. ओके, टेक about 7 to 10 days covering major subjects, 5 to 6 covering intermediate, and about 3 days, I believe, for shorter ones, yeah, minor subjects. ऐसे 3 months में करो. उसके बाद स्विच टू 2 months, उसके बाद गो टू 1 month का LRR, दैट्स इट। अगर 100 क्वेश्चंस कर रहे 40 मार्क्स आ रहे हैं, हाँ अच्छा तो है। 100 क्वेश्चंस कर रहे 40 मार्क्स आ रहे हैं, धीरे धीरे बढ़ेंगे ना। अभी अभी तो देखो 40% पे तो ऑलरेडी आ गए हो, 50 तो लाना होता है। ऐसा नहीं है 50 का गोल नहीं रखना होता है, बट इट्स बेटर अगर 50% आ रहे हैं तो यू विल इम्प्रूव ना। अभी तो बहुत टाइम है एग्जाम के लिए, अभी से इतने आ रहे हैं तो यू विल गेट वेरी गुड मार्क्स। या आई बिलीव दैट्स इट। ऑलराइट, एनी टिप्स फॉर नीट पीजी? मैंने तो नीट पीजी नहीं दिया है, बट आई बिलीव ऐसा ही, यू जस्ट हैव टू स्टडी ऐसे ही। सेम रिवीजन स्केड्यूल फॉलो करो, इतने ही क्वेश्चंस करो। बट या मेन क्यू बैंक करना है। मेन डिपेंड करता है आप कौन से फेज ऑफ उसमें हो। अगर आप यूनिवर्सिटी में हो, 5th 6th ईयर में हो, देन हाँ टॉपिक वाइज करो, टॉपिक वाइज क्यू बैंक करो। बट अगर लास्ट 6 to 8 months में हो, स्टिक टू PYQs। क्योंकि कितने क्वेश्चंस करोगे, और जब कस्टम मॉड्यूल करोगे ना तो उसमें ऑब्वियसली मेन क्यू बैंक वाले क्वेश्चंस आएंगे ही। सो स्टिक टू PYQs 50, और कस्टम मॉड्यूल में 100 फॉर 19 सब्जेक्ट्स, राइट? ऑल राइट, आई थिंक दैट्स इट। ओके, आई थिंक दैट्स इट।